I am going to now hand it over to Carol Mosier, who's going to introduce our panel and talk to us a little bit about why we're here today. Carol?
Great. Thank you, Nicole, and thank you to Field Group for all the hard work you guys have done to get us to this day. Good morning, and thanks to everybody for joining us. My name is Carol Moser. I am the Executive Director of Greater Columbia Accountable Community of Health. We are one of 9 accountable communities of health across the state, established by the state legislature in 2015 to implement the Medicaid transformation waiver. Our goals as ACHs are to promote health equity and address and coordinate around social determinants of health, among other efforts to improve access and quality of care across the state. Our Greater Columbia region includes 9 counties: Kittitas, Yakima, Benton, Franklin, Walla Walla, Columbia, Garfield, Asotin, Whitman counties, and the Yakima Nation. We are so excited to introduce the Practice the Pause campaign and the training, tools, and resources to our region. As we know, COVID-19 has taken a toll on all of us, and as individuals, we are happy to provide the tangible education and materials to help everyone deal with the behavioral health impacts of the pandemic. So on our panel today is Dr. Carrie Waterland. Dr. Waterland is the Assistant Director of Behavioral Health and Recovery at the Washington State Healthcare Authority. The Healthcare Authority is partnering with the ACHs across the state to transform our healthcare delivery system. And Carrie will be discussing the impacts that we're seeing across the state in regard to COVID-19 and behavioral health. We're also joined by Dr. Kira Mosseth. Dr. Mosseth is a practicing clinical psychologist with Snohomish Psychology Associates and an instructor at Seattle University, and she specializes in disaster behavioral health. It was Dr. Mosseth that developed the COPE Calm Care skill models that are the basis and the foundation of Practice the Pause campaign that we're going to be discussing. She'll be talking to us more about COVID-19 as a natural disaster and how these tools can help us recover and build resiliency. Andrew Over is the Regional Market Vice President for Cambia Health Solutions. Washington's 9 accountable communities of health have received $2 million from Cambia Health Solutions to address urgent mental and behavioral health needs intensified by COVID-19 in rural communities. Cambia has contributed $245,000 to this campaign to help make training and materials available to all students, families, and organizations throughout our region. Lillian Bravo is the Director of Public Health Partnerships with the Yakima Health District. YHD also contributed nearly $60,000 to Greater Columbia to help adapt the COPE Calm Care skill models into toolkits for families. Dr. Robbie Nelson is a clinical neuropsychologist with Catholic Charities serving Central Washington. We are contracting with Dr. Nelson and Catholic Charities to provide the training and outreach portion of this campaign. I'd like to say that all of our panel participants are available to answer questions following our presentation today. I would like to start by hearing from Dr. Waterland about what we're seeing across the state in regard to COVID-19 and the behavioral health impacts. Dr. Waterland?
Thank you so much, Carol. First off, hello, my name is Carrie Waterland. I'm with the Division of Behavioral Health and Recovery at Washington State Healthcare Authority. And just wanted to say how glad I am to be here today to support the exciting work from Greater Columbia ACH. Very, very excited. And so I have the opportunity to kind of walk through the stage setting of where we're at right now in Washington State. And while we know that we're solidly on the road to recovery, our research does show us that it's going to take time for us to recover from not just COVID-19 physical symptoms, but really those behavioral health impacts of this pandemic. And so looking at the January 2021 update from the statewide high-level analysis, which gives us some forecasted behavioral health impacts from COVID-19, just kind of wanted to give some overviews as to the why of the importance of all of this work that the ACH is putting together and moving forward. So we know that early 2021, is really going to be an extension of the disillusionment phase of disaster recovery. Right now, there is a risk of suicide, depression, hopelessness, and substance use disorder. And we know that because we are seeing that in our data, but we also know that because historically research shows us that these things are really the highest during this phase of any disaster. And so we've got the research that shows us historically that is what we should be looking at potentially seeing, and that does match what we're seeing. We are seeing an awful lot of these just responses and reports of suicide and depression feelings. So what does that mean? That really means that the need for professional behavioral health support, as well as community resources, supportive resources, are really, really likely to be at their highest need in the first few months of 2021. And what we already know also is that this is occurring at a time where community resources are already stretched thin. And so looking at an already stretched thin community and looking at this, we're potentially looking at an increased need for community resources. We really have that decreased ability to support an increased need. And so how do we look for some natural supports around that and really supporting the community as a whole? We know that behavioral health experiences in this phase of the COVID-19 pandemic typically include, as I've talked about before, symptoms of depression and anxiety. Sometimes those look like trouble with cognitive functioning. We have been at this for a little over a year now, and people are exhausted. And so exhaustion and burnout are also symptoms that you will likely start to see people either experiencing or talking about, or you have historically been seeing people really, really talking about or experiencing symptoms of depression, anxiety, exhaustion, burnout. And so what we know is that active resilience, really, and developing active resilience remains that essential intervention for all of Washington. That's how we get through this, is that resiliency building and development. We know that our health officials in Washington state, we expect that behavioral health issues related to isolation and stress and those fears of the unknown of COVID-19 and tying in the unknowns of when folks are going to be getting their vaccines, even though we do have information about how that's rolling out, people still have some questions. And so we know that the isolation, the stress, the fears all around this can potentially escalate medical risks for individuals as well. So it's something to keep in mind, that behavioral health and physical health really are tied to each other. Some of the other things that I'm really hopeful people will notice, I'll let you know where you can find a copy of this report that I'm talking about, as well as the historical reports. We've really been educating the public on depression and anxiety symptoms coming up and the need to be aware of those. The newest thing on this report for January 2021 is really focusing on behavioral health outcomes for survivors of COVID-19. We know that as more individuals are infected with COVID-19, that creates more survivors of COVID-19. And we are just starting to see new and emerging research come out about specific things really that folks should be aware of in regards to working directly with survivors of COVID-19 and behavioral health needs. Treatment providers really should be aware that this could be new instances of anxiety and depression, could be instances of post-traumatic stress disorder. And then there is a new diagnosis that is identified as post-COVID-19 psychosis. And so the February 2021 report that's coming out sometime next week will actually expand on this information, the data, the trends, and a lot of these points that we've discussed. And so I just wanted to let folks know that that is available at doh.wa.gov. And be looking for the January report now, and next week the February 2020 report will be out for everybody to review. Carol,
Thank you.
Thank you, Carol.
Speaking of resilience, Dr. Mostav, I'm going to turn to you now. And you're the expert in explaining more how COVID-19 is a natural disaster and the 3 skills that you have developed to help individuals cope and build resilience to these impacts of COVID-19. Tell us more about your COPE, CALM, and CARE skills models.
Thanks, Carol. I'm happy to. And thanks, Dr. Waterland, for sort of setting that stage about where we are in the pandemic as a process. It really helps to understand that the context that we are experiencing right now comes from this lens of disaster psychology, disaster behavioral health, and disaster recovery, because COVID-19 is considered as a pandemic a natural disaster. So we know a lot about how people process disasters, how we recover, and the sort of experiences that many people have as we go through a disaster response and recovery cycle. And the COPE, CALM, CARE models and skills are designed to address each of the sort of areas where people need the most support. As Dr. Waterland was alluding in terms of the numbers that we're seeing and the concerns that people are having across our state right now, it's more important than ever for these skills to be accessible and available to people within families, within households, and within communities as professional resources are really stretched. So that's part of the reason why we wanted to sort of boil these things down and get them available out to as many people as is possible to really increase that sense of community resilience and to give people something concrete that they can try to work on that's not too complicated. So in the development of these 3 models, they're broken down into thinking, doing, and being. And that's done intentionally because those are the 3 areas of behavioral health recovery focus in a disaster where I have found in my work and in my research that people tend to get the most active result, the most positive result by focusing on those 3 areas. So the COPE skills are the thinking skills, and that's about recognizing that the way you perceive and the way you process information and think about the situation that you're in really can predict how you feel about it and then what your resulting behavior is going to be. So the COPE skills are about checking for your automatic response, sort of practicing that pause. And that's sort of the theme with this whole campaign. Each one of these skills models is designed to request, I guess, that the person practicing it would stop, take a moment, practice that pause, and then dive into sort of finding a new way to try and handle something, or even if it's just making a slight difference in what their normal response would be. So those COPE skills start with taking that pause, practicing the pause, checking for your automatic reaction to whatever the situation is, and then observing the way that your emotions and your behaviors are connected to that initial automatic reaction. The third step in COPE is to plan for an alternative. And in this case, an alternative thought might be just something slightly different. So for example, if your automatic reaction is, this pandemic is never going to end, the emotion and behavior connected to that thought might be, sadness and hopelessness. If you plan for an alternative, it needs to be reasonable. So an alternative in this case would be something like, the pandemic might take longer than I'd like, but we will get over it eventually. We will get done with this thing eventually. And if that's your new alternative thought, the resulting emotion and behavior are going to be much more positive in general. The last step in the COPE model is to execute change by practicing. And those can be small ways of practicing every day, just tiny little bits. And if you do that over time, you'll end up in a very different place from a resilience and from a behavioral health perspective. The second model in the COPE, CALM, CARE skills is the CALM model. And those are things that you can do to control your body's response when it gets threatened. One of the most important things, and it's very cliche, but it's still very true, is controlling breathing and heart rate. You can't panic when your body isn't in panic mode. So teaching kids and adults alike to sort of monitor their own breathing reaction and to try and calm themselves down as much as possible physically will prevent them from being anxious in any given situation. So the CALM skills are all about, again, practicing that pause, slowing down, controlling breathing and heart rate, really paying attention to the present moment. Right now, we are okay. And it's not about what happened yesterday or what might happen 3 days from now. It's about right now in this moment, people are okay. And that's what the A in CALM stands for. If we can attend to the present moment, we're more likely to feel better, at least in that moment, about how we're doing in general, because that's not consistent with where anxiety comes from. The third part in the CALM model is about listening to thoughts and feelings, just acknowledging it And if it's a negative one, or if it's a difficult one, letting it wash over you and focusing back on that present moment. So controlling your breathing, attending to the present moment, really getting connected with what you're doing in the here and now, listening and observing your thoughts and feelings, and then mastering relaxation by practicing any old ways you can find to calm your body down, and scan for muscle tension, and where you're holding your anxiety and your sense of pressure. If you can learn how to physically calm your body down, it goes a long way in terms of helping people master both anxiety and depression. So that's what the calm skills are about. The third group of skills models is about caring, and that's about the fundamental aspects of resilience building in terms of how we relate with other people and what gives us motivation and purpose in our lives. It's about connecting to other people or ideas. We know that connection is an essential part of resilience, and connecting to other folks can be as simple as just checking in with a neighbor, or it can be as elaborate as, really getting invested in a particular social cause that you feel passionately about, or it can be about caring for a loved one or a family member. It's about any person or idea that prevents you from being isolated. The next one in the care model is about accepting change and sort of learning how to roll with things. As a clinical psychologist, I think honestly that learning how to accept and how to be flexible is probably one of the most important aspects of resilience in general. It really is strategic, and it really makes a lot of sense to learn how to adapt in such a changing set of circumstances and in the context of a disaster in order to thrive later on. The third part is about being reasoned with yourself, and that's being intentional and about reasoning why you're doing what you're doing. Who are you interacting with? What are the choices that you're making? How are you choosing to spend your time? That's how you do things intentionally and purposefully, and a day that can be sort of reasoned out with why you're doing what you're doing generally feels better than a day when you just sort of haphazardly go through your emotions. The last step in the care model is about being engaged in mindful living. And that's about thinking about ways that you can intentionally connect and intentionally contribute to something that's bigger than yourself. That is another sort of essential piece of resilience in general. So each one of these skills models is about practicing a pause, taking a moment, and then finding a way to intervene in your own life to help you feel better. So the first set of models, the COPE skills, are about how to think differently. The calm model set of skills are around how to feel differently physically. And the care set of skills are around how to relate differently and how to be differently as a navigator in your own life. And there's a lot of empowerment associated with that for people. It's very helpful. So each single one, first of all, applies to both kids and adults alike. These things can be practiced and they can be applied for kids all the way from young 4 or 5 years old all the way to older adults throughout the lifespan. And they all start with just practicing a pause, taking a moment to realize what it is that we're feeling and why we're feeling that way, and then making a choice to think, be, or act differently. So the GCACH campaign, this whole process that we're talking about here, were developed around this idea of starting by practicing a pause. So Carol's going to take it from here and discuss a little bit more about the campaign and how it incorporates the skills models that I was just discussing.
Thank you, Dr. Mazza. Okay, so we're all going to practice the pause. I want everybody to take a deep breath. Okay, now we can get on to the next portion. I'm actually going to turn it over to my program director, Diane Halo, who's going to discuss how Practice the Pause incorporates the COPE Calm Care Skills models. Diane?
Thank you, Carol. The Greater Columbia Accountable Community of Health, GCACH, has adapted Dr. Mossett's trainings and materials for public use. GCACH developed a series of toolkits for teachers, parents, providers, and others to use to help children, students, patients, and anyone else to learn to cope with the behavioral health impacts of COVID-19. GCACH hired Field Group to develop the toolkits in both English and Spanish for age groups 5 to 12, 13 to 18, and adults. They include activity books, stickers, journals, coping strategies, and other tools to help both individuals and community resilience. Currently, GCACH is running a dual language advertising campaign throughout our region. That includes TV, radio, streaming services, digital, billboards, and print advertising. The English language landing page and the media kicked off on January 18th, and it was followed with the English language landing page that was kicked off on January 25th. Every day we're adding new materials, and we're continuing to do this weekly, and the campaign is expected to run through April with the current funding. GCACH is offering free training throughout the 9-county region. For people that may request the training, you can go to the website practicethepause.org, and also the toolkits are available to download from the website, or you may request to have the printed materials sent to you, and you can use the link on the website as well. The Practice the Pause campaign has become a multi-agency effort and coordinated and primarily funded by GCACH. GCACH put in $500,000 from the Media Waiver Program. Carol, I'll turn it back to you.
Thank you, Diane.
You went mute, Carol.
Thank you. I'll try this again. So as Diane said, the funding came from the Medicaid waiver, which has allowed all of the ACHs across the state to test innovative projects to improve health in our region. But we couldn't have developed this campaign without the help of Dr. Mossack, who created the skills models that the campaign is founded on, and Catholic Charities, who's providing the really important training that goes into the schools and into the community. Again, thank you to the Yakima Health District, which donated $60,000 for the development of the campaign toolkits. And Cambia Health Solutions, you allowed us to extend this campaign and really get into the school systems with printed materials. So we couldn't have done this without you either. Because of your donation, we're going to be able to distribute materials to all 58 school districts in our 9-county region, which is huge, and that incorporates around 140,000 students. So thank you to Andrew and Cambia. I want to thank everybody for your support and participation in this campaign. And here today, we could not have done all of this without you. And now I'm going to open it up for questions, and I would encourage those who are here to ask our community partners why they felt compelled to support the campaign. Thank you.
Thanks, Carol. And if anyone has questions, you can identify yourself by raising your hand. We sent out a lot of materials, so there may not be a lot of live questions.
Nicole, I was wondering if we would want to open it up to any of our panelists that didn't speak, maybe Andrew or Robbie or Lillian for any of their comments.
Donald Myers has a question from Yakima Herald Republic first.
Okay, great.
Yes, since January, what has been the response to the program, and have you seen any indications that it's working? Or is it too early at this point?
Dr. Nelson, do you want to take that?
I was really hoping you would let me. I was getting really excited. Even just hearing the first half of the question, I thought, oh yeah, that's a good question. Yes, absolutely. It's definitely not too early to be seeing the positive impacts of this. One of the things that we have been really fortunate to do is start the rollout in not only the Catholic school system, but also the public school system in ESDs 105, 123, and part of 101. And the response from the teachers specifically has been incredibly overwhelming, just in terms of gratitude and being able to have a toolkit for helping students and their families. We're doing these trainings not just for teachers and administrators to be able to use these skills in their classroom for their students, but also we're hosting evening trainings for parents, for how to help their students with the emotional fallout of the COVID-19 pandemic, but also themselves as parents and adults, and how to work through that. So there's been a huge response, and we are doing a whole lot of training rolling out, and there are more requests every day. And so we're fortunate to have a very enthusiastic and large team going out into the school systems. We're also going out into other community agencies, NAMI, YWCA, some of the behavioral health organizations and medical organizations have requested training as well. We're going up to Wenatchee Valley College. And so there's a lot going on, and the response has been incredibly positive.
Donald, do you have a follow-up?
I guess the question is, how do you measure success with this program?
Carol, do you want to
Sorry.
take?
Were you coming to me, or were you going to somewhere?
I was going to hand that over to Robbie too, but we do have some outcome measures in terms of the number of schools that we're reaching, the number of people being trained, and the number of providers that are participating in the training, the number of hits to our website. We've had some great initial outcome measures for that, but I would encourage Robbie or Dr. Mosseth or Dr. Waterland to respond to that as well.
Yeah, we also have some pre and post training surveys that are measuring exactly that. They're measuring the effectiveness of the campaign as well as the impact in terms of breadth and depth of the campaign.
Donald, any additional questions?
That's it for now.
Thank you. And Carol, you had mentioned, if anyone else has questions, please raise your hand, but you had mentioned having our community partners speak as well. I know Cambia, having Andrew speak to Cambia's for state involvement and their large participation in behavioral health.
Yeah, I'd be happy, excuse me, I'd be happy to. Thank you very much for the opportunity to join you today. We at Cambia Health Solutions are extremely excited about this, and specifically around the topic of resiliency. You know, as a result of our longtime work addressing health disparities, we anticipated the fallout from the COVID pandemic would disproportionately impact marginalized and underserved communities. And I think that this campaign in terms of helping to build resiliency, and Carol, that was fantastic news to hear, that will be in every school across the 9 counties, is just so critical. As a father of a 6th grader and a 3rd grader, I feel like I know firsthand some of the challenges that our kids are going through. And so equipping them and their families with techniques and services to address that is critical. I'm not at home right at the moment, but in my home office, over my shoulder, I generally have a worksheet that one of our medical directors created early on in the pandemic around building mental resiliency, and it's a reminder there for me, as I'm spending so much time during the day on camera, to be able to see that and to have that there, and to know that we're able to come alongside the Greater Columbia ACH and as well as the Yakima Health District and Catholic Charities to help in this effort means a lot to me personally on behalf of Cambia. So thank you very much for your efforts, and we're proud to be a part of it.
Oh, thank you, Andrew.
Do we have any additional questions? In the Q&A, we did have one question that just came in. Can you tell me about the Yakima Health District and their partnering with the campaign?
Sure. So again, as the Yakima Health District, our mission really is to protect and improve the health of all of our community residents. So we know that even though, of course, COVID-19 is our primary focus, we have always been acutely aware of the different residual impacts that this may have in our community, and specifically behavioral health. So we're also hearing from the schools, we're hearing from families, community members. Absolutely nobody has been left unimpacted by this time. And so with that, we've been extremely thrilled to have the opportunity to partner with everyone to bring this very necessary resource to our community, because we know we don't all live in a vacuum, and we need the tools. And again, I think that's what we've been hearing the most, is having something tangible in multiple languages, reaching multiple of our communities is what's needed across this region. And so being able to partner locally with evidence-based practices is something that, of course, we wanted to support. And again, just knowing that these issues in general related to behavioral health, they're not new. And so, of course, with the pandemic, they've been exacerbated. So knowing that now there's a toolkit, now that there's a system in place for partnering together to address this, I'm excited at what this means for the future and partnering related to behavioral health as well.
Thank you, Lillian. And Carol, do you have anything else to add?
About Yakima's involvement or just in general?
In general?
No, I just think that, you know, before we heard Dr. Massa, she actually came to one of our leadership council meetings in September, and I didn't realize, or I didn't put the two together, that COVID was a natural disaster. You know, we just knew that we're dealing with the pandemic and we were all feeling anxious, but we didn't realize that those were normal reactions to a natural disaster. So just having that information, understanding what we can do to address it. I mean, really taking a pause. I mean, it really does help to breathe. And now I'm hearing more and more kind of resiliency messages that I wasn't aware of before. So we're excited to have this information in the hands of our community members, in the hands of parents who are dealing with kids that are also stressed out. We're just really excited as an organization to be able to have this opportunity to message, you know, practice the pause and give people the skills that they need to deal with it. So I just wanted to thank everybody again for their involvement, and we hope it's a successful campaign, Dr. Mosseth, and we're going to be testing out your models to see how well they work in our region.
Would any of the panelists like to add anything before we sign off today?
I'm thrilled. I think it's really exciting. It's really great to see proactive work being done in this way that empowers people at every level across communities, and giving teachers and parents and kids themselves the tools that they need to be able to work on their own resilience in this kind of direction. I'm really excited about it. A lot of disaster behavioral health is around preparation as well as response and planning. And in my opinion, it's never a bad time to work on resilience, ever. So now here we are. So thank you. Yeah.
And Robbie, did you have something to add as well?
I was just going to add that if organizations are interested in getting training, that there is that link. I think actually Diane may have said that on our website, practicethepause.org, there's an option for that. And so if there's some community interest, we are more than happy and more than able to provide that.
And we have recorded this session today, so we will make it available to anyone who's interested, as well as push portions of it out through social media. And we appreciate all of our panelists for taking the time today, and the reporters and attendees who joined us today. If you have any further questions, please feel free to reach us through the Practice the Pause website, practicethepause.org, and Diane's contact information is there. Again, thank you all very much for attending today. Carol, anything before we sign off?
Just practice the pause. It really works.
So thank you all, and please feel free to follow up if you have any further questions or needs. Appreciate it.
Thank you.
Thank you. Bye.